I'm just getting on a quick video. I asked the other day if anyone would be interested in knowing how to test for low thyroid at home using just a thermometer. And why would you want to do this? Well, I'm doing a lot of research lately on the thyroid. If you know me at all, you know that I've had a lot of thyroid issues since I was 19 years old. So I've done a lot of battling in that area, and I was lucky enough to know that it's my thyroid, where there's a lot of Americans who have no idea what's wrong. They don't know what their symptoms mean. They go to doctor after doctor after doctor to find some relief from some of these symptoms, and some of the symptoms are actually quite surprising. Some of them we expect, and some we don't expect at all. So with that, I'm reading a book called Hypothyroidism, The Unsuspected Illness. It's this book here. And this is probably the most in-depth reading I've done on the thyroid. And of all the years that I've done research on the thyroid, this is probably one of the best books I've read. So if you're interested, I'll put in the comments, I'll put the name of it again, just to make sure that you have the opportunity to read that. But I was actually really surprised by some of the things. I know what my own symptoms are, and I actually know what some other people's have expressed to me several times, like, I'm low energy, I have this going on, I have this going on. And I'm like, that sounds like your thyroid. Have you had that checked? And they'll go, yeah, I had it checked and it came back normal. So we're not going to do anything about it. So that got me thinking, as I was reading this book, how many people probably go undiagnosed and have low thyroid. There's a couple of things about this that are really important to know, that a lot of times we don't know. And one of those things is how prevalent it is, but it's not prescribed as often as it should be, because there is a range. You have from the low side of numbers to the high side of numbers, and if you fall within that range, you won't be prescribed any thyroid medication. You may not know that you have a thyroid issue, and that's not always the best indicator for hypo or hyperthyroid that there's other indications. So the best way to know if you have low or high thyroid hormone in your system is to test it at home, quite surprisingly. And the way you do that is you get a really good thermometer. They don't really sell mercury thermometers anymore, that I've been able to find. If you're lucky enough to have one, those are the best. If you can't get that, the next best is just a basal thermometer. You can find them in the fertility sections at Walmart or the drugstore or whatever. You just get those basal thermometers. The difference between a basal thermometer and a regular thermometer, the best I can tell, is its accuracy. Is that the basal thermometer has 2 decimal points. It gives you a little bit more of an accurate number, and they're pretty regulated because they're used for fertility purposes. And a regular thermometer probably would work too, but the better thermometer you can get, the better it is. So if you are male, you can test your temperature anytime, because you don't have the fluctuating body temperatures that a woman does. A woman, you would need, if you're menstruating, then a menopausal woman or a child who is not menstruating yet would be able to test their temperature anytime as well. But a menstruating woman, you would start on the second day of your cycle. That's when you would test your temperature for 3 or 4 days, because then your temperature is going to fluctuate through the month, and that's how come you can use your temperature for fertility reasons. But for to get your basal metabolic temperature, you're going to need to do that starting on the second day of your cycle, because that's where your temperature is, where you can test it most accurately. And you test it for a few days in a row. You get yourself a baseline, see where you're at. you, in order to test your temperature, you're going to, after a good night's sleep, keep the thermometer next to your bed. And as soon as you start to wake up, put the thermometer under your arm, not in your mouth. There's too many variances in your mouth, so you would do it under your arm, and you would hold it under your arm for 10 minutes. And my experience with a digital thermometer is that you will want to not turn the thermometer on right away. You would like to put the thermometer there for 10 minutes and then turn it on. If you're using a mercury thermometer, then you can just look at the temperature at 10 minutes. So you'll want to use the 10 minutes and see where your temperature is, and you'll write that down. You'll write that down for 3 days. So you want your temperature to be between 97.8 and 98.2. Now, if your temperature is below 97.8 for several days in a row, then that is low. That's a low temperature, and that indicates a low production of thyroid hormone. It may not show up in tests as a hypothyroid on a blood test, but it would be enough to to cause symptoms in your body. If it's above 98.2, then you have too much thyroid hormone. It's a very consistent and a very accurate test. Believe it or not, it's really amazing. So if you are on thyroid hormones, then you'll be able to know if you're getting enough. If you're not on thyroid hormones or supplementation for your thyroid, you'll know if you need it. It's up to you whether you go to your doctor and maybe they'll work with you to see if you can get something. But there's also plenty of things on the natural market for your thyroid. If you've had your thyroid partially removed, or if you've had your thyroid radiated like mine was, you may not be able to supplement with normal supplementation as someone would be able to with just a low functioning thyroid, because you can feed your thyroid the way your diet is, your nutrition, and actually consuming raw desiccated thyroid. You can get those in pills at the natural health food store. You can get it from like VitaCost. There's lots of places you can get that. My personal favorite for supplementation for the thyroid is actually a Young Living product called Thyromin. The reason I like this product so much is because it not only addresses the thyroid, but it also addresses the adrenals and will address the pituitary gland. And with the endocrine system, it's a very complex system. And so if your adrenals are suffering, your thyroid will suffer. If your pituitary gland is suffering, your thyroid will suffer. And if your thyroid is suffering, both your pituitary and your adrenal glands will also suffer. But not only that, it affects your liver, it affects your pancreas. All of the endocrine system is affected when your thyroid is not performing optimally. So these are just some things to know if you didn't know them already. Some of the symptoms that you can have, some of them are surprising and some of them are not surprising. A lot of things that we think of when we think of a low thyroid, we think of weight gain. We think of maybe see how my neck is a little bit puffy. That's because of my thyroid being a little out of balance right now. And so that gland will get swollen. So if you feel your neck, you can see how this is where the thyroid gland is. So you can touch and you can feel if it feels swollen or if it feels puffy at all, or if there's excess tissue there, maybe a slight goiter or something like that can grow over the thyroid, and that can obstruct your airways. And so it can be quite dangerous if you don't do something about that. So we see things like that. We think about being overweight being one thing, and that's true. That can be a symptom. It can be very difficult for some people to lose weight if their thyroid is not functioning optimally, mostly because it's our energy system of our body. So if our energy system is not metabolizing correctly, that's where we come up with our metabolism. Then our metabolism will not support what we need to be a healthy weight. So we need to work on that. But some people actually have a hard time gaining weight if they're not getting enough thyroid or if they're getting too much thyroid. When I was making too much thyroid hormone, I got extremely thin. But then I also gained a lot of weight, and my weight would fluctuate in large proportions, 30 to 40 pounds in a matter of weeks. It was pretty bad. Still, right now I don't fluctuate to the extreme of the thin, but I do fluctuate within my weight based on how my thyroid's doing. And so I know a lot of people struggle with that. An abnormally low energy level, it can be something that is expected with low thyroid. But some things that aren't expected are respiratory issues, chronic illnesses, childhood illnesses, asthma, acne. There's, in this book, Dr. Barnes talks a lot about some different symptoms, and he goes very in depth about each of them. And so I'm just going to look at the contents really quick and just kind of go over, we know about fatigue, we know about dry skin, but you may not have known that chronic headaches and migraines, even the things that we say, oh, that's a sinus headache, that can also be, it's very related to the thyroid, inflammation and things like that. One thing that surprised me as I was reading and as I was studying, I was like, I wonder if the thyroid, if it's functioning low, if that could possibly be related to, maybe that could be, maybe ADD or ADHD can be related to how the thyroid is functioning. And as I was thinking about that, I was like, that would make a lot of sense. So I started doing some research about that, and I found that there is a correlation. It's not necessarily caused by it. There's other reasons too, but a very high correlation of ADD and ADHD with thyroid function, which really got me thinking about a lot of things. And so I was thinking about that, and then I was looking at the respiratory issues, muscle aches and pains, chronically getting sick with respiratory issues, arthritis. Arthritis can be caused by the high cholesterol. The cholesterol is highly regulated by your thyroid hormones. So if you are high cholesterol, the likelihood of your thyroid being low is high because the thyroid has protection for your heart. And so that's a big one too. Infertility is a kind of surprise. I thought that was surprising. But the instances of infertility in those with low thyroid, but a lot of times the infertility in people that aren't low thyroid, if they get their thyroid tested and they do the basal temperature test, they will find they are low. And then once they get that corrected, then they're able to conceive and carry a baby through full term. The miscarriage that we experienced last year was a thyroid-related miscarriage. And so I'm not surprised by that because I know that my thyroid has issues. So, and I found out my hormones were very low. So I had to fix that. But now, I found that by correcting that, you can carry a baby to full term. We've made it to quite further past what we miscarried last time, so that's really great. Let's see. It can also it can relieve endometriosis and fibroids that can be traced back to a lack of thyroid hormone because your body's immune system is compromised when you don't have enough thyroid hormone in your system. And that's what it boils down to. The thyroid doesn't cause any of these diseases necessarily, but your immune system is compromised. And once your immune system is compromised, then you're more likely to experience things that you wouldn't experience if your immune system was not compromised. It can also be traced to diabetes and hypoglycemia. It's obesity and what it does to your skin in the aging process, to what it does to your body in the aging process. All of those are things that are directly related to that energy system of your body, and we don't give it enough credit. One of the things that can give you a false negative in your blood test, I have learned recently through some of my doctors and some of those that I trust that have helped me in this journey, taught me about how the thyroid hormone works in the body chemically. And so, as I study that, if you look at some chemistry of your body, the TSH is the hormone that's in your bloodstream. It's produced by the pituitary gland, and the thyroid stimulates the pituitary. The pituitary gland stimulates the thyroid on how much hormone to make. So if either one of those are out of whack, your TSH levels will be out of whack. But what you need to understand is your T3 levels too, which is the T4 is what's normally tested, TSH or T4. But when you go do a thyroid panel, you need to ask your doctor or your lab technician to do a full thyroid panel, not just your TSH, but your TSH, your T4, your free T3, all of those things. There's like 6 different ones that you'll want them to look at when you do your thyroid panel with the lab. That's if you want to go to your doctor if your temperature is low. So once you do all of that, you're going to see the differences in how your body is using the thyroid hormone. So it's one thing to have it. It's another thing for your body to be using it effectively. So your body needs iodine in order to convert T4 in the blood into a usable T3 for your cells. So what's going to happen is your blood, your T4 is going along and it needs to gather a iodine compound, and it uses that iodine compound, converts it to a usable thing for your cells, pumps it into those cells, and then now you've got your thyroid responding, your metabolism's going, and you're good. So what happens is we fluoridated our water. We have a high amount of chlorine in our water, and if you look at the periodic table, the way the periodic table is laid out is during each column of the periodic table, you can switch one element for another in the same column because they have what's called the same valence, which means that's how many receptor sites that it has that it can exchange electrons with another atom. So when it's gathering an iodine, if there's another particle or element in your body that can be substituted for iodine, sometimes that will happen, especially if you're lacking iodine and you have too much fluoride or chlorine in your system. And if you're drinking tap water, or a lot of even bottled waters and things like that have fluoride and have chlorine, trace amounts or sometimes large amounts, and we're consuming a large amount of that in our diets by drinking tap water and going to the dentist and using fluoridated toothpaste and things like that. And so it makes a pseudo T3, which cannot be used by the cells. So the process happens, the T4 exchanges into T3 without an iodine. It uses, let's say, fluoride. It uses a fluoride compound, and then it switches to T3, but now it goes to go to the cell, and the cell rejects it because it doesn't have iodine in it. And that's one of the reasons why it can show a negative test to say you're fine when you're not, because your body's not using the hormone that's there. But I found that interesting as I looked more into that, and I would suggest you do some research on that and look at that and read about that. That way, if the symptoms that you're experiencing relates back to these things, then you'll know a place to start. And there is some wonderful supplements out there that aren't prescription, that are natural. And I know a lot of, I'm huge into keeping it as natural as possible, as often as you can, and being as natural as you can. And sometimes medicine is necessary. And that's okay. I mean, I have to take an actual hormone for my thyroid because it is necessary for me, and I had to accept that. It took me a little while to accept that, but I did. And then once you can get help with this, once you can start with that, then you can start making progress in your body, and then that changes your life. So I would be happy to walk you through that. If you want me to, just send me a message and let me know that you would like some more help on that. I'm going to post this book in the comments, so if you're interested in doing some reading, it's pretty intense reading, but it's really interesting. It's really good. One more thing before I hop off here, I want to tell a success story with doing this method that's not me. My husband has been diagnosed ADD when he was a child, and he suffers from horrible muscle aches and pains, and it has a really hard time getting up in the morning. He has a hard time with his skin being clear, so he has some acne things going on. There was a lot of things that were concerning. He didn't really know what to do about. And so I've been trying to find some natural things to help him get progress with this. And so as I was reading this book, I saw several of his symptoms came up in this hypothyroidism book. If you've seen my husband, he does not look like your typical hypothyroid. He doesn't have any swelling in his skin like I do. He's extremely thin, can't gain weight. All of these things. I was like, well, there's no way he's hypothyroid if he can't gain weight. So I was doing some more research and found that some people actually can't gain weight because of a lack of thyroid hormone, which really surprised me. So I started taking his temperature. It turns out he had a low temperature, lower than I expected, and so which that shows a lack of thyroid hormone. And so I was like, oh, my suspicions are right. What are we going to do? So I started him with, in the beginning, with one Thyromin right at bedtime, and he took the one Thyromin, immediately saw a difference. The next morning, he was actually able to get up and get moving without coffee. First time ever, he said. His muscle, he went from hardly being able to move the day before because of his muscle aches, and his back felt like it was going to go out, to being able to move again. He said it wasn't perfect, but it was progress, and that was in one day. So after a few days of that, I checked his temperature again. It was still on the low side. It was looking more normal. It was looking better. So I added another one to it. So he started taking 2 Thyromin at night, and he's been doing that for a few days now, and he says it's like night and day. He's been praying to have a day where he feels normal, and he's finally getting that. And that's because we finally figured out that a lot of his symptoms are hypothyroid, not something else. And he's already also experiencing some clarity in his mind, which is the ADD part. So it's really interesting to see how these things connect and how the thyroid is connected to everything. It's some things that you wouldn't expect. So I would encourage you to do a little more research on this, read this book, talk to some people, reach out and ask questions. I'd be happy to answer anything that I can. And let's see if we can make some progress together. I've shared some of my journey with my thyroid. It's been a tough journey. And so if I could do anything with that journey, is to help other people overcome some of the same issues and to overcome some of those same symptoms and actually live the life that they want to live and not succumb to being exhausted or sick or in pain. So any of those things that I can do, just let me know. Send me a comment, send me a message, and let's connect, and I will help you. So thank you so much for coming on and watching and being interested enough in for me doing this video. And I am excited to help, and I'm excited about the progress that I've made in this research. It's really, really interesting, and I'll be sharing more as I learn more. And thank you so much for coming on here, and I'll see you soon. Hi, Amelia. So glad you're on here. All right, bye.